Hi everybody, my name is Dr. Daniel Grunert, and today I would like to do a demonstration on how we treat carpal tunnel syndrome here in this clinic. Carpal tunnel syndrome is one of the most common peripheral entrapment neuropathies. That is, it's the most common place to trap a nerve in the extremities, such as your arms or your legs. Now, the median nerve is the culprit behind carpal tunnel syndrome, and that nerve originates between the vertebrae of your neck at C5, travels through some muscles through your shoulder, travels past your elbow, dives through a muscle in your forearm, and eventually travels through a tunnel in your wrist, known as the carpal tunnel. And that carpal tunnel is made up of 8 carpal bones, and following through that, with that nerve, are 9 tendons of muscles in your forearm. And when those tendons become inflamed in that tunnel, that causes pressure on the median nerve, which results in the pain. Now, the goal, both surgically and manually, is to relieve the pressure off that nerve. But what most doctors don't look for is what's known as a double crush syndrome, where the pressure on the nerve is not only located at the wrist, but it also could be located in the forearm, elbow, between the muscles of the neck, or the vertebrae themselves. So today I'm going to show you how we treat all those regions in order to relieve you from the symptoms of carpal tunnel syndrome. Okay, the first thing that we want to do when treating carpal tunnel syndrome is to relieve the pressure from the neck. So what I'm going to do is an adjustment, a chiropractic adjustment. You may hear or feel some popping or clicking, and that's a release of gases from the joints at the level where the median nerve originates from the neck. And that will relieve the pressure off the nerve that could be involved with the double crush syndrome when suffering with carpal tunnel syndrome. So the next thing that needs to be done is you need to relieve the stress on the muscles called the scalenes, which assert right here and then travel underneath the clavicle here. And the median nerve dives between these two muscles, and when those muscles become too tight, that can also be involved in the symptoms of carpal tunnel syndrome. Again, this is when you're treating the double crush syndrome. True carpal tunnel syndrome only comes from the wrist, but when there's other areas that are involved, you get the best results. So you strip the scalenes like that. Now the next thing is that there is a muscle in the forearm called the supinator. And the supinator can get really tight, and that's where the median nerve dives right through the belly of that muscle. And if that muscle gets too tight, then it causes pressure on that nerve that also is part of carpal tunnel syndrome. So we use ultrasound, this little Sonogel, in order to relieve the tension in that muscle causing the pressure on the nerve. Okay, and then finally, you want to adjust the carpal bones that make up the tunnel where those tendons and the median nerve travels through. If those carpal bones are subluxated and not moving through their normal ranges of motion, that can cause the inflammation and pressure on that nerve. There we go. And that's it. So was that pretty cool? I mean, I really enjoy being able to relieve the pressure off of the nerves, and typically when treating carpal tunnel, people will feel better within 1 to 2 weeks, probably 3 to 6 visits or so. So it doesn't take long to start feeling better, so don't suffer unnecessarily. And once you're done being treated, there's also home exercises that you need to do, and probably wear a brace at night. So if you have any further questions about carpal tunnel or want to talk to me or have an assessment, feel free to contact me. All right, thank you.